So we couldn't have this conversation without inviting Senator Deeds, who is here, and I'm so glad he decided to join us. Delegate Landis is here as well. Delegate Wilt is here. He's only here for a short while, but he's here. Didn't mean that. Tony, you're here. We're glad you're here. But we wanted to gather folks together. I want to give a shout out to people who have been working with me on this forum. So Ellen, are you ready? Ellen is our facilitator, and she's the executive director of CSB, which is the Community Service Board here in Harrisonburg. Celeste Williams, raise your hand in the back, director of the Harrisonburg-Rockingham Social Service Department here, and Costello Forney, who is the pastor of John Wesley United Methodist Church. Harvey Yoder. Y'all know Harvey, raise your hand. Licensed professional counselor at Family Life Resource Center. Kelly Royston, raise your hand. Crisis Intervention Team Coordinator at Harrisonburg CIT. Summer Sage. Hi. Executive Director of Free Clinic. Have I missed anyone? All right. So I'm going to now turn it over to Ellen. She's going to facilitate for us today. We have about 2 hours. Hopefully we can wrap this up by 1. We are going to hear from Senator Deeds, and then we'll hear from Senator Landis, and then we're going to open up for you all to speak, because we want to hear from you as well. So we'll have questions and answers, or if anyone would just like to speak, it's fine, okay?
As part of the facilitation, and good morning, I was asked to talk a little bit about the Harrisonburg-Rockingham Community Services Board, and I do like to talk about mental health. So I am going to take a couple minutes to talk about what we do, give you a little bit of information about how busy we are, what's coming down the pike for us, and then hopefully we'll set the tone for the information that you might need to generate some questions and a good conversation with our esteemed delegates. And
official, so that you know that we care about this issue. And so we couldn't have this conversation without inviting Senator Deeds, who is here, and I'm so glad he decided to join us. Delegate Landis is here as well. Delegate Wilt is here. He's only here for a short while, but he's here. Didn't mean that. Tony, you're here. We're glad you're here. But we wanted to gather folks together. I want to give a shout out to people who have been working with me on this forum. So Ellen, are you ready? Ellen is our facilitator, and she's the executive director of CSB, which is the Community Service Board here in Harrisonburg. Celeste Williams, raise your hand in the back, director of the Harrisonburg-Rockingham Social Service Department here, and Costello Forney, who is the pastor of John Wesley United Methodist Church. Harvey Yoder. Y'all know Harvey, raise your hand. Licensed professional counselor at Family Life Resource Center. Kelly Royston, raise your hand. Crisis Intervention Team Coordinator at Harrisonburg CIT. Summer Sage. Hi. Executive Director of Free Clinic. Have I missed anyone? All right. So I'm going to now turn it over to Ellen. She's going to facilitate for us today. We have about 2 hours. Hopefully we can wrap this up by 1. We are going to hear from Senator Deeds, and then we'll hear from Senator Landis, and then we're going to open up for you all to speak, because we want to hear from you as well. So we'll have questions and answers, or if anyone would just like to speak, it's fine, okay?
as part of the facilitation, and good morning, I was asked to talk a little bit about the Harrisonburg-Rockingham Community Services Board, and I do like to talk about mental health. So I am going to take a couple minutes to talk about what we do, give you a little bit of information about how busy we are, what's coming down the pike for us, and then hopefully we'll set the tone for the information that you might need to generate some questions and a good conversation with our esteemed delegates and representatives sitting here. So, after we're readers, because I can't see. The CSB has been around for about 46 years, whether you knew that or not. We have been. We started as a very small organization, and we are now a much bigger organization, about 200, 240 people. We help people across the lifespan. So our youngest clients are less than a year old. And we do that all the way up until someone ages out of services, which is usually when they pass away. We are out into the community. We work in the homes, we work in the schools, we work in the jails, we work in the emergency department, and then we have 2 clinics that we operate also. One is an adult clinic, and one is a children's clinic. So we're everywhere, and you may or may not know that for us. Some of the services that we provide, and I won't go through the entire comprehensive list, but it's important for you to realize, because I can't tell you how many conversations I've had where somebody said, I didn't know you did that. I didn't know you did that. Oh my gosh, you do that too. So I want to just give you a little highlight of some of the things we do. We have the infant and toddler connection. So if your child, 0 to 2 or 3, has a 25% delay in their development, we're out there in the community, in your home, providing services. That could be speech therapy, occupational therapy, physical therapy, and coordination of care. So we start at the very beginning of life trying to help people get the best possible start in their life. We do family care coordination. And family care coordination is transitioning people, those are little kids, from residential services or foster care back into their homes. And we have about 11 kids in the family care coordination element. We have 180 kids in the infant and toddler connection. We do children's therapy. We have 521 children in therapy right now as we speak. This is a point in time. This is not overtime. So we have children in therapy. We do adult therapy. That's mental health. 309 people are in mental health therapy. 199 people are in substance abuse therapy. We have an intensive IOP, intensive outpatient, which is about substance abuse. It's the maximum of 10 people in that group, and we have 10 people at all times. And then we have drug court, which is 25 people. We also offer over 20 different groups for people in the evenings and during the days for substance abuse and mental health. And they're ongoing. It's on 10 different topics. We do case management for adults in mental health, which is 415 or 221 children in case management for mental health services. And then we have 314 for developmental disabilities and 228 people on the waiver list for that. We also do medication management. The medication management is over 1,200 individuals. That's 340 who are children and 875 who are adults. So yes, we stay very busy. We're in your schools. We have clinician time in every school, middle and high school. That's 3 city and 9 county schools. That's not a full-time clinician in every school. Maybe one day we'll get there, but we do have some clinician time in every school. We're in the jails. We have a full-time case manager who does transition planning in the jails and also does assessments. And then we have 3 hours of nurse practitioner time in the jail as well. And then the crisis intervention team. We have some folks here who are active in that as well. It's a partnership of many agencies. It has a 40-hour curriculum for law enforcement and complementing services of law enforcement. We trained over 379 individuals in crisis intervention, and it has to do with mental health. It's a huge lift. It's 4 times a year. But we're very dedicated to doing that. We're excited that it happens. We're also in the emergency department of Centera RMH, where they are Monday through Friday from 4 to 12 during their peak hours with a law enforcement officer and a mental health clinician doing assessments. And we have mobile crisis. We have adult mobile crisis and we have children's mobile crisis. So we try to get there before the crisis escalates, or we try to help with the aftermath of that. The adult team has a law enforcement officer and a mental health clinician, and the child team is a mental health clinician. So we're very, very active. We have crisis stabilization, which is an inpatient 7-bed unit that stays full almost all the time. We have a partnership with the Department of Health, where we are teaching Revive, which is the opioid overdose, and we distribute free Narcan to the public with the trainings. We have behavioral health and wellness, and we actually have some of that back in the back. Brandy is helping with that, and we are very active with training over 200 individuals on suicide awareness, trauma in the brain, substance abuse in the brain, applied suicide and intervention skills, and mental health first aid. And she has distributed over 272 trigger locks for your guns to keep those safe, 265 medication lock boxes for those people who have medicines and they want to keep them from anybody else having to be able to get them, and 350 medication deactivation packets. When your medication has either expired or you no longer need to take it, you can get your medication in there and it'll completely make it mush so nobody else can take it. And then finally, we do jury debriefing. Sometimes when you're on the jury and there's been a pretty traumatic event, being on the jury can be traumatic for those jurors as well, and so we do the debriefings for that in addition. So as you can tell, we do a tremendous amount of things in the community. We quietly do it, and we're very excited about the work that we do. I hope you learned something about that today. What I will say is, looking back over the last 8 years, we've experienced about a 54% cumulative growth in the total number of unique people that we've served. So when I say unique people that we've served, just last year we served 4,200 people. Those are individuals. Now we see people more than once, right? And we also have people in multiple programs that complement each other to really provide the services that someone needs to get back on their feet. So that's a lot of foot traffic that comes through our door, and that's a lot of services that get delivered over the course of a year, 4,200. But when we start to look forward and think about the number of people that we'll be serving in the future, and we start to project out how many people that might be, over the next 7 years, we are anticipating about a 40% increase that'll put us at 6,700 people. Again, that's just the individuals, that's not the services that are delivered, so it's a lot more services than it is individuals. We're a fairly significant employer as well. We employ over 240 people. About 82% of those are clinical, and then the remaining part are administrative, so we have a lot of clinicians on site who are providing services either in the clinics, East Washington Street McNulty Center for Children and Family Services, or the Main Street Center at 1241 North Main Street for adults. We're out in the community, as I said, we're in the jails, we're in the schools, we're in the emergency department. You may not know it, but you're seeing us everywhere. But if you do the math in your head and you look at this particular sheet right here, and it shows sort of the projected growth of the Harrisonburg and Rockingham County area, what you're hearing about what I'm saying about a 53% growth rate doesn't match up with the growth rate of Harrisonburg and Rockingham County. We thought, you know, a little bit of that is probably the stigma is starting to dissipate a little bit, and people are starting to know a little bit more about us. But the other thing that really has triggered our growth very recently, since 2017, is the changes in the General Assembly's code for us. So up until 2017, the CSBs had 2 mandated services that they had to provide. We could provide a lot of services, but 2 we had to provide: emergency services and targeted case management. Everything else really came down to whether there was funding for it and whether it came into their performance plan and what the community needed. In 2017, it was a game changer for us. The Virginia Code changed and introduced STEP Virginia, Systems Transformation, Excellence, and Performance. Because CSBs only had 2 services they had to provide, of the 40 CSBs in Virginia, we all look a little different because of what our community needs. So when you go to one CSB, it looks a little different than the next CSB, depending on how we've evolved over time. Remember, we're 46 years old. So now there are 9 core services that we are excuse me, rolling out that all 40 CSBs will provide services for. 9 core services. This is neat, it's exciting. The first service excuse me, is same-day access. Before same-day access, when somebody wanted services, they would come in, they would make an appointment for an intake. Intake would usually be about 2 weeks later. We had about a 50% no-show rate, right? And then we would serve the people who actually made it through the door and got the intake. Same-day access is getting an assessment the same day that you requested, the same day. So this has changed the way we do business, and it has changed the way the community expects us to do business, because we're getting people in faster. We had a 25% increase just since last year in the children's services by going to same-day access. So it was a huge influx of children for us. We did 1,500 intakes in the last year of new people coming into services. So for us, STEP Virginia is exciting. We started same-day access. We were one of the first 8 CSBs to be getting that rolled out, and then the rest of the CSBs have been finishing up doing that, and those community services boards are done already with same-day access. And we're moving on to primary care assessments, outpatient services, we have crisis services, targeted case management, psychosocial rehab services, peer support, care coordination, and veteran services that are coming online all by 2021. So the anticipated growth for us is pretty significant in terms of the number of people served and also the number of clinicians that we'll need to have on site to help roll that out. What I will say is the General Assembly also started Medicaid expansion, as you know, on January 1st. That was a pretty exciting thing for us because that's a complementing part of building out the system. How do you pay for the system? You need to have insurance a lot of times to be able to access some of the care. And it's not just behavioral health care, it's also medical care. So it's that holistic approach to our community being stronger and healthier. So the Department of Social Services has been super busy. We estimated about 7,000 people in the Harrisonburg-Rockingham area that would be eligible for Medicaid expansion. And at the end of February, which is just 2 months into it, they have already enrolled 3,228 adults into the Medicaid expansion. That's significant. That's significant. So the pressure point for many in our local and our state government is the pace of building pathways to care as fast as the demand requires it. What do I mean by that? Medicaid was expanded to basically enhance the access, and building out the providers is going to be a heavy lift for all of us to make sure that we do that well and to make sure that we have enough providers to care for our community in a way that we need to. There's a roadmap for the Community Services Board at STEP Virginia, Systems Transformation, Excellence and Performance. We are started in that, so that's already underway. And to build a better foundation, and the foundation has to be strong and well organized for it to be effective for everyone and so that treatment can be accessed in a meaningful way. There's so much we can do for our community as we build up and we build out in our service delivery, creating opportunities for health and creating a community of strength. We're so fortunate today to have our elected officials with us to begin a conversation about what are the mental health priorities for us in this community and what are the mental health priorities in the General Assembly. And to identify those needs and start that conversation. So we're thankful that you're here. Thank you so much for that. And so I would like to turn it over to you and let you have a few moments.